welcome in to Your Health and be our guest, and we just have the greatest guest. And we have Dr. Porcia Love today.
Thank you.
And Dr. Love has River Region Dermatology and laser. And we're going to talk about as we age, and it starts, fairly early. You don't have to be all that old.
Very early.
What are the things that we look at that are just natural aging processes?
Okay. Well, actually, when we talk about aging, we talk about intrinsic aging and extrinsic aging. And so extrinsic factors are things that occur in the environment that can cause you to age a little bit faster. And the most common are things like the sun or smoking. But what can happen with those are you can get fine lines and wrinkles. You can also get brown spots on the face, a little discoloration on the face. There's a condition called melasma that's very common in women in the South, where you start to get brown patches on your forehead, your cheeks. Some women come in and say, I have this brown mustache. Where is it coming from? But that's melasma, and it's just a combination of aging and sun and hormones. So that's extrinsic. And then intrinsic are determined by genetics. And that can include where you start getting the dark circles under the eyes, you start getting the bags under the eyes, gravity sets in and those jowls start to form, those lines start to form around the cheeks. You start to notice the lines on the neck, and then a lot of women start to thin. And so those are things that can happen in both men and women, and those are all things that we treat here at our office.
So are there ways to treat those things that don't involve actual surgery?
Oh, definitely. Everyone wants to hear about the latest minimally invasive technique. And so there are just a number of ways you can treat things. Starting at the top, the hair is as you get older, your hair starts to thin. And so we have several treatments for that. One of the newer ones is PRP, which is platelet-rich plasma therapy, where you use your own plasma to regenerate hair follicles. And that can also be used with microneedling on the face to help with those lines and those wrinkles, some of the acne scars that people get over time. For the brown spots that you can get from aging, you can do lasers for that. You can do chemical peels, things like that. That can help with the brown spots. And then the lines right here, everyone knows about the fillers that are out. Those are minimally invasive. They don't involve surgery at all. In terms of the neck, as this starts to sag a little bit, we have a device here called Excelus Ultra, which combines radio frequency, which is bulk heating. It gets down into the dermis, which is one of the deeper layers of the skin. And then it also has ultrasound and helps to tighten. So we can tighten this up without any incisions. And so those are just minimally invasive ways. They don't replace surgery, but they are an alternative.
Now what about, you hear so many stories that are pro and con. Is there really skincare line products that really make a difference? There are a lot of people, my mom I think just used Pond's cold
Yes.
And we have come so far with all the science. Really and truly, are there simply skincare lines that make a difference?
I think there are skincare lines that they've done a lot of research on, dermatologists and scientists that have researched some of the skincare lines to show that they are a bit more effective. We have two big ones here at our office, Skin Medica and Skin Suticals. Skin Suticals was actually established at Duke University, where I did my medical school and residency training. But they have products that they have researched that I do think are a little bit better than some of the over-the-counter products. And then Skin Medica also has growth factors and things like that have been researched heavily amongst dermatologists and research scientists. And I do think they are a bit more effective. I always tell people, if you've tried the over-the-counter products, then there is something a little bit better if they want to make that investment. But I do leave it up to the patient.
Well, I think that, as we grow older, I think that it's nice to be able to look as good as you possibly can for as long as you possibly can.
You want to age gracefully.
without being cut on.
Yes.
I like that. I love that idea. I'm not into being cut on. But I just think that it's so nice to know that there are things like that that you can do. I noticed there's something for the under the chin.
Kybella,
what is
yes,
that?
it's an injection. So Kybella is deoxycholic acid, and it's used to dissolve fat underneath the chin. And so the patient comes in. Our patients typically get at least 2 treatments spaced out about 6 weeks apart. And you get a series of injections underneath the chin to dissolve that fat. You'll have some swelling for about 3 to 4 days. And then after that, the fat slowly dissolves and the skin tightens. So that is an injection to get rid of what we call submental fat, or that double chin that people refer to.
Well, we all have it sooner or later. Thank you for at least letting us know there is something that we can do.
There is.
And that is always good to know. Thank you, Dr. Love.
You're welcome.
Yeah, appreciate it. And thank you so much for watching. We'll be right back.